Jackson Hospital is Dr. Andrew Moore. Good morning.
Well, thanks for having me.
Thanks for being here with us today. Now, you're a orthopedic surgeon, and we're going to talk a little bit about ankles today.
Yes.
You know, I'm not at the age, we talked before you were here, I'm not at the age where I worry about my ankle yet, but you tell me that's coming.
I'll tell you what, everyone my age, that's all we talk about is orthopedic surgery.
Yeah. Yeah.
Well, thanks for keeping us in business.
So so talk a little bit about the ankle. When do you know it's time to get seen?
You know, if you're pain, most of the time it's pain. You know,
Yeah.
you start to have pain and it starts to interfere with what you want to do. The other thing is if you've had an injury and it didn't get better like you thought it would, or you couldn't walk on it, sometimes you have a severe injury and you just have to be seen right away. But if you have what you think is a minor injury and it nags you and it keeps going, then you ought to get it checked out.
Okay.
Now, from what I've heard all these years is that the foot, the ankle, that is the most complicated orthopedic surgery that you could go through.
There's a lot of variety of different problems, and I would say that probably less understood than the rest of the orthopedic world until maybe 15 years ago. We finally started learning. We had some major pioneers over the last 30 or 40 years, some of them from Michigan, who helped us understand things better, but it really hadn't caught up to getting the same kind of outcomes, which is really based on our understanding, until maybe 10 or 15 years ago, and it's really accelerated in the last decade or so.
Tell us a little bit about your background, how you ended up to choose the specialty.
Well, I trained at, I went to medical school after college, and then I went to University of Michigan for residency, and was sort of undecided if I was going to specialize or stay in general orthopedics. But I was sort of attracted to foot and ankle halfway through because there was so many new things, and there was so much different variety. There's probably as many different operations that we can do and different problems that we can treat in orthopedic foot and ankle as there is in the rest of orthopedics put together. So I thought, well, I wouldn't get bored if I did this. Mm-hmm. And I feel like it's very important to people. It's a small part of our body, but it carries everything.
Yeah, we talk about we hear about hip and knee, shoulder all the time, but like you said, the weight of our body is on our foot and ankle.
Yes.
Can you sometimes have leg pain or poor legs that's causing the ankle pain?
A lot of times that's the case. And it could be that, people talk about radiating pain, well, the pain radiates in my leg, but a lot of times it's not necessarily that. It's just that there's something structurally wrong or going wrong with the foot and ankle, and then the rest of the leg is trying to deal with that, and then that's why the leg hurts. That's maybe why the knee hurts.
Total ankle replacement, it sounds pretty complex. Do you
remove
the foot off?
One of the things that I have found about the ankle is when we think of the ankle is a group of bones, but when surgeons talk about the ankle, they really just mean the tibia and the talus bone, the upper bone and the lower bone. And when you do an ankle replacement, you're resurfacing just that joint. There are other joints that contribute to what we call ankle function, but we don't address those specifically with the ankle replacement.
How do you know if it's time for your ankle to be totally replaced?
Typically, if you've seen a physician and you've tried other non-surgical strategies, because a lot of times those work and manage symptoms without the risks of surgery, but once you have come to the conclusion that those other things just are not giving you the quality of life, and your physician believes that the results of surgery could be predictable, and in relieving your pain or improving your function, then it's time.
How can we postpone some of those late mobility issues? I'm observant. You don't walk like you used to. I don't want to get to that point. Mm-hmm. How can we prevent some of that? Maybe prevent or delay surgery?
Well, there's really two causes of why ankles go south on people. And the one is we've gotten a lot better at managing, and that's inflammatory disease like rheumatoid arthritis and that kind of thing. A lot of us think of osteoarthritis, so that's the wear and tear arthritis we're familiar with in the knees and hips. That's actually a lot less common for the ankle. The number one reason that we have problems these days is injuries. Mm-hmm. So repetitive ankle sprains over and over again, and then sometimes failure of tendons where the foot develops a deformity can result in ankle arthritis, or car accidents with broken bone above it, that seems to be highly related to developing ankle arthritis. So some of that we can't really control. But if you have an ankle that sort of gives out on you all the time, it doesn't necessarily hurt, but it's always giving out. Don't just put it off and say, well, I'll just change what I do. Maybe go see someone, because there are things that we can do to stop that, so that you don't end up with an ankle replacement or ankle fusion down the road.
If one is bad, is the other one?
The fusion versus the replacement?
Well, if you have one ankle replaced, does that mean that the next step is to get the other?
No, believe it or not. It's usually one side, not always, but it's not as common to be both sides as, say, knee or hip replacements.
Interesting.
Yeah, because typically the hip, people will have one, and then a couple years later, there goes the other one.
Is that because we're dominant with one of our legs, like we are with our hands?
Partly, and also because ankles don't normally just wear out like hips and knees do.
Right.
But usually you just had the injury to the one ankle, and so that's why it got arthritic.
Do runners tend to have more issues?
They have issues, but not arthritis so much. And that's one thing that's been very interesting to see. Is I have people who've run for 30 or 40 years, large numbers of miles a week, and their ankles look beautiful a lot of times. They may have some pain with this, that, or the other, but it's usually not that their ankles are wearing out.
Your uncle?
My Uncle Bill. Me,
Yeah.
myself.
He-
I had
he
an
runs-
overuse
run-
ankle
run.
injury.
Yeah. What's this replacement thing made out of?
Well, there's just like hips and knees, you have two different parts. You have a component that is metal, and that is usually titanium that the bone sort of grows into to make it stable. And then you have a plastic component, and the plastic component has a very predictable and low friction wearing surface, and that can often be replaced if it does wear out. And that's what they call polyethylene. So it's a type of plastic very similar to what we use for the shell and the hip replacements, or on the bottom of the tibia, on the tibial tray for the lower part of the knee replacement. It's the same kind of plastic. And in this case, we hook it to the bottom of the leg bone, and it clips in, or sometimes it has a little socket that it moves in depending on the design, and the lower part is metal.
That's cool.
It will set off all the alarms at the airport.
Yes.
Yes, and I always say, I have artificial things in me, and could I just bypass security, please? And no, that seems to make a bigger problem.
That's okay. Well, as long as you're feeling better.
Other things people can try, because, and really, I think you hear this a lot. Well, you're a surgeon, you're going to want us to do the surgery, because that's. But will you try to get somebody relief non-surgically if they really aren't ready for something like this?
Absolutely. Our goal is you come to us with a problem, and our goal is to solve the problem and create the least amount of risk. And I would say I see about 10 patients that I treat non-surgically for every one that I do surgery on. My goal is never to do surgery unless that's the best option, and that's what the patient wants.
I have a friend, they just had a bad experience with orthopedic surgery somewhere else, out of town, and they said, we never saw the surgeon. He never said anything to us before the surgery. We never saw him after the surgery. He never even said, hey, hi, I'm here. I'm going to take good care of you today. And when you hear about some experience like that, it tends to make you even more fearful of going through this process.
Yeah, it does, and it makes you feel like you're sort of a specimen or just another number, and that maybe that the surgeon just considers you another data point or another dollar sign, and that's not how it should ever be. The decision is the relationship is between you and your surgeon, and surgery is not risk-free, and so you need to have somebody who's invested on the other end. So fortunately, where we are, I'm very happy with the way the culture is at Henry Ford, that doesn't happen as much.
Dr. Andrew Moore is with us from Henry Ford Jackson Hospital Orthopedics, and more with Dr. Moore after this.
At Consumers Energy, we believe change is preparing for the worst by putting to work the very best. Change is improving by replacing utility poles and redesigning our substations. Change is commitment to upgrading 1,000 miles of our energy grid every year. And change is confidence, the confidence of knowing when it comes to keeping the lights on, we're always on. Consumers Energy, a force for you, a force of change.
Improving the air quality in your home isn't a luxury, it's improving your family's lives. Our staff do each job carefully, completely, and with great attention paid to you, the homeowner. We take care to leave each home better than we found it, and when you take your first breath after one of our cleanings, I'm sure you'll agree. We can help keep your home cleaner and your air safer by scheduling a cleaning today. Ducks, we're your indoor air professionals.
Witness the difference at Jackson Catholic Schools with a guided informational tour for you and your child. Learn firsthand about our schools, programs, and curriculum. Enrollment for the 2022-2023 school year is now open. Find out for yourself what makes Jackson Catholic Schools special and witness the difference.
You need a plumber? From leak repairs to new construction. Grimes Plumbing Company, licensed and insured, proudly serves the Jackson area with fast, reliable service. No hot water, drains clogged? Call Grimes Plumbing today, proudly serving Jackson County.
We're back with Dr. Andrew Moore, orthopedic surgeon at Henry Ford Jackson Hospital, and fixing people's ability to walk or get around, the mobility. It's so important. It's got to be very rewarding.
It is, and sometimes the worst orthopedic ailments you can have are ankles. You have somebody comes in and says, "I couldn't even walk across the parking lot to get in here," and we can't always fix everything, but we can usually make it a whole lot better and make it a whole lot livable. And sometimes we can really almost totally eliminate the pain. There's usually a trade-off. For instance, some decreased range of motion or that kind of thing that we can't necessarily make totally normal. We can't always make you like you're 20 again, but we can usually make it very livable. And so that is a very rewarding side of what I do.
People are able to give up the wheelchair or the walker after they go through something like this?
That would be the hope. If you spend too long in a wheelchair, everything seems to atrophy, and sometimes it's hard to get completely back. But if you can even go up one level of function, so that you can walk short distances and you can fend for yourself around the home, then or you can fit in a shoe that you couldn't fit into because of whatever was going wrong. That can make a huge difference in your quality of life.
How important is that post-operation care? I mean, you'll see a lot of people are stubborn. They won't want to use the cane or the walker, things like that. But how important is it for that total healing?
It is, and the reality is, I would say, look at it this way. We can screw everything back together. We can hold the two bones together, but if you walk on it before the bones are healed and the screws loosen, there's no other way to tighten it except for to open it back up and tighten it. So take the advice of the surgeon who's been working with that type of problem and who can give you an idea how long it's going to take before it's safe to really do things, and that way you don't ever have to come back and do it again.
Yeah, I think the hesitation to do surgery is, oh my God, I'm going to have to take the summer off just for the rehab. But it's a critical part, but it's not as long as people fear. And
we're working hard with the advancements to try to cut down on it. We understand that, so I've seen a huge improvement in the recovery time. That surgeries that we used to ask non-weight bearing for 2 months are now immediate weight bearing and that kind of thing, and it makes lives a lot better. We're finding better outcomes, less blood clots, less complications that way.
Very good.
Yeah, you're out of you're in and out, really. It's almost, is it outpatient?
A lot of surgeries are. It depends on what it is. A lot of times we'll have someone spend the night for pain management or for elevation if it's a really involved surgery. Yeah. But for a lot of operations now, even broken ankles and broken calcaneus or heel bones and things that used to spend 2 or 3 days in the hospital, we usually do them outpatient now.
If you're not familiar with the advances in modern medicine, you still think it's like surgery from 20 years ago.
Right.
So it's amazing. You talk to people that have recovered from a replacement, and a lot of times you hear it, well, I wish I would have done that sooner. It was so much easier than I thought. And the immediate pain relief.
Right, and the other thing too, do it local. I had my hip replacement
Yes, you did. Local.
local, and so I know the doctor, and I've been able to stay in touch. He stays in touch with me, and if I have issues, it's right here.
Yep.
If there's so much to be said for keeping that part of your healthcare and
For
all your
sure.
healthcare local. It really makes a difference.
I think so too.
Yeah. Have you done 2 ankles at once?
I have, yes. I don't usually do 2 ankle replacements at once because the recovery is so hard from those,
Yeah.
and we've even learned from knee replacements that that's sometimes not the best idea. But I have had situations where I've had to do both sides fused with big rods and all kinds of things for people who have severe problems, and they say, you know what, I'm going to lose my next 3 months. I want you to just do them together and let's get this done. And I'm okay with a wheelchair, and in the right situation, it's very doable from my end. And it's the question is it something that the patient can deal with? And for some patients, that's the right way to go.
We were talking about golf earlier, and Tiger Woods had that leg and ankle injury. How amazed are you that he was able to come back just a short time after that type of vicious leg and lower leg injury?
He's amazing as an athlete and a healer. Those are not easy to come back from. It sounds like he had great care, and he had a great ability to heal. He won't be the same probably, but he'll find a way to compensate and get through it. And that's what the human body can amaze you in what it can do sometimes in those severe injuries.
If someone thinks they need a surgery or need some help with their foot or ankle, can they just contact your office?
Right, that's right. We have an office in Jackson and another office opening in Chelsea as a secondary office later this month. So we're just at 517-205-1431. That's Henry Ford Jackson Orthopaedics.
Awesome.
Great. Thanks for coming in today.
Well, thanks for having me.
Yeah, thank you.
From Henry Ford Jackson Hospital and Henry Ford Orthopaedics, Dr. Andrew Moore. Up next, we'll talk about how you can help the Jackson County Animal Shelter. Stay tuned.